Hey everybody, and welcome to Motivational Monday, where you can learn how simple shifts in your habits can lead to profound results in the way that you feel and in the way that you look. So the most important thing you can do for your health is prevent disease, and the way to do that is, well, various ways. You can eat really well, which is something that we talk about here every single week. You can exercise, which is also a very key aspect of taking care of yourself, resting, managing your stress levels. All these things are important. What's also really important is to make sure that you go to the doctor once a year and have a checkup. Make sure that everything looks okay, feels okay, sounds okay, but what you also want to do is make sure you get a series of blood work done once a year so that you can see where you stand, where in that moment, that snapshot of what's happening inside your body can give you a lot of clues and a lot of information of what nutritional deficiencies might be developing, what problems might be lurking, or it could just give you a clean bill of health. But either way, you should be informed and you should know. So today I'm going to go over with you the blood tests that I think are really important to have included in your blood work panel that might not necessarily be included just on a standard blood test. So what your doctor will automatically do is a CBC, which is a complete blood count, and that basically tells us if you're developing, it tests all your red blood cells and tells us whether you're developing any anemias. It'll also test your white blood cells, and it'll see if any infections are developing or any sort of immune imbalances are developing. It'll also go over your bun-creatinine ratio, your uric acid levels, so that tells us a little bit about what's happening with your kidney function, and it'll also give us your liver enzyme. So that's a complete blood count, and that's something that your doctor will automatically do. In addition to that, you want to make sure your doctor is doing your cholesterol levels. Now, I've often seen blood work with just the total cholesterol numbers given without the breakdown. And the breakdown is super important because you might have an elevated cholesterol of 210, but 90 points of that might be a good cholesterol, and you might not know that unless the breakdown is present. So ask your doctor that in addition to your cholesterol level, that you want the breakdown so that you know where your LDL is, your HDL, and your triglycerides. In addition to that, you want to check your GFR. That's called your glomerular filtration rate, and it tells us a little bit about how well your kidneys are filtering toxins out of your body. This is important because a value of anything over 60 is considered normal. But if you're at 61, you want to know that you're at 61. So see if you can get your doctor to actually give you the calculations so that you know your exact number. Once you know that, you can start making adjustments in your diet to help protect your kidneys long term, because kidney function is really important, not just for your kidneys, but it also has a backhanded and very important role in the way of your heart, maintaining healthy heart function. So make sure that your doctor tests your GFR in addition to the other kidney values that are tested in a CBC. You also want to go into your blood test fasting and have your doctor test your fasting glucose levels. And that basically tells us how well you monitor your blood sugar over the course of 12 hours, 14 hours, 16 hours or so. It gives us an idea of basically what happens in a day. If you're too high or you're too low, that's information that's important to know, because it might be telling us if you have diabetes or you're maybe insulin resistant or you're hypoglycemic. So go in there fasting and have them check that as well. But that is usually a standard test performed with a blood test. If you carry weight in your midsection, if you're overweight and you tend to have weight mostly in your midsection, then you might want to also have your doctor check your Hemoglobin A1C. This value gives us a measurement of how well you are stabilizing your blood sugar or managing your blood sugar over the course of 3 months. Whereas your fasting glucose really tells us a little bit more about what's happening in a 24-hour period, your Hemoglobin A1C is a way more accurate value to let us know how well you stabilize your blood sugar over 3 months. And that's a great indicator to let us know if you're on the road to developing diabetes or insulin resistance. So again, if you are overweight or store weight in your midsection, your Hemoglobin A1C might be an important value to know. The next test is one that I often mention in my videos, and it's often left out of a traditional blood test, and that's your vitamin D levels. The reason this is important is because we have been seeing study after study after study that shows that vitamin D supplementation, having adequate vitamin D in your body, is super important to help protect against certain cancers, keep your immune system in check, help with mood disorders, a whole host of issues. So rather than just supplementing vitamin D randomly, what doctors tend to do is say just take 400 units, but 400 units may not be sufficient at all if you have intestinal absorption issues or if your number is too low. So have your doctor draw that number, draw that blood test, and then supplement accordingly. And that is a super important blood test to have included, and it might not be traditionally included. You might have to pay out of pocket for that, but it certainly would be worth it. If you find that you struggle to lose weight, or your hair is thinning, or you have lots of water retention, then that might point to a problem with your thyroid. So if any of those symptoms are happening for you, then you want your doctor to test your TSH. So that's a thyroid-stimulating hormone, and that gives us an overview of what's happening with your thyroid. I ask my doctor to do it every single year because I find that that's a number that, in my patients, that it could be fine one year and not fine the next year. So just to have an understanding of where I'm at, I have them test that every single year, even though I don't show any symptoms of any thyroid problems. But it's just something that you want to catch and know exactly what's happening as soon as you can know. So TSH would be the other one. If you're a man over the age of about 35-40, then you might want to also ask your doctor to do your PSA. That's your prostate-specific antigen, and it tells you what's happening with your prostate. Anything up to 4 is considered normal, but you might bounce around. So some people go up to 7 and drop down to 2, and it could just be a sign of an infection. But it's a good idea to get that number tested early on in your life so that you have a baseline. You know where you stand, so at any point if it starts going up, you can look into it further. So if you're a guy and you're over the age of 35 or 40, your PSA would be important to know. The next test I think would be really valuable to know is your cardiac C-Reactive protein. And this is a measurement of inflammation or infection in the cardiovascular system. Some doctors include this test on a general blood test, many doctors do not. If you have a history of heart disease in your family, or you have other cardiac risk factors like elevated cholesterol levels or high blood pressure, it's a valuable number for you to know. Anything under 3 is considered okay, and you're pretty much safe in that zone. But if you, like I said, have any predisposition to heart disease, or it runs in your family, then you might want to ask your doctor about your C-Reactive protein, specifically your cardiac C-Reactive protein. So there's one more test that I want to mention, and some doctors routinely will test this, and some doctors absolutely find no value in testing it at all, and that's your homocysteine levels. Your homocysteine is an amino acid that gets raised over time with age, and what it can do is it can weaken the arterial wall. So some doctors like to know what that number is so that they can get a good comprehensive view of what's happening in the cardiovascular system by knowing your cholesterol levels, your C-reactive protein, and your homocysteine, while other doctors believe that there's enough research out there to debunk homocysteine as any risk factor at all, so they won't test it even if you specifically ask for it. Personally, I think information is useful. So if you know you have heart disease in your family, it's useful to know any possible number that you can know, because there's different reasons people have heart attacks. For some people it's inflammation, for some people it's weakening of the arterial wall, for some people it's kidney disease that creates a cascade of events in the body that then leads to heart disease. So you really want to know all your risk factors so that you have a better assessment of what might be the problem. There are people who have terribly high cholesterol levels, but if you take a scan of their heart, everything looks perfectly clear. So that's not their problem for them. So it's good to know where you stand, and homocysteine, I find, in conjunction with these other tests, is a valuable test to have in your arsenal for information. So again, it's down to what your doctor is willing to test, and whether you're willing to pay out of pocket for something that he might not value as a test for you. In addition to those tests, there might be other tests that might be necessary for you based on your lifestyle. So for example, if you're a vegan, you definitely want to test your B12 levels and see where they stand. You want to check your iron levels, see where that is. So based on what's going on in your body, you might need other tests that you should discuss with your doctor. If you have malabsorption issues because of an eating disorder or erratic eating habits or inflammatory bowel disease, then again, you might really need to test a little bit further to make sure that you have proper nutrients in your body so that you can supplement accordingly if not. So those types of specialized tests should be discussed with your doctor based on your lifestyle and habits. So when you go to your doctor, be straightforward, be honest, let them know what's going on, tell them about your eating habits so that they can make appropriate recommendations and test accordingly so that you know where you stand. So there you have a bunch of tests that you can talk to your doctor about and see if they would be appropriate for you. But whatever you do, I would encourage you to have your checkup done once a year and be proactive in your approach. Don't just go in there and allow your doctor to test for whatever they traditionally test for, because everybody's an individual and everybody needs different things. So write the names down, discuss it with your doctor, and see if they think that's right for you. So thanks for joining me. It's always nice to be with you on Monday. If you like tips like this and you're looking for more of them, come on over to barbaramendeznutrition.com and sign up for the mailing list there. Once you do, you will automatically receive a video or a written blog from me every Monday with some inspirational tip or recipe or suggestion to move you closer to your health goals. You can follow me on Facebook or Twitter, and if there's anybody you know that would benefit from this information, please pass the video on to them. Thanks so much, everybody. Have a great Monday and a wonderful week, and I will see you next time.